All right. Welcome, everybody. Got another minute or so before we get started here. Welcome, 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 everybody. We will begin promptly at noon Pacific time. Thank you for joining us today. Okay, there it is. My name is Alan Barr, and I'd like to welcome you to the NIOSH-supported education and research centers throughout the country. We're pleased to present another installment of the 2020 ERC Ergonomics webinar series, offering free monthly webinars on various topics on human factors and ergonomics. And this collaborative effort on behalf of each ERC's continuing education program aspires to provide access to current research supported through NIOSH ERC programs. And thank you for joining us today. As a reminder, all participants who log in today with their registration email will receive a link to a recording of the webinar and an evaluation form that will qualify participants for a certificate of completion worth 1 continuing education contact hour. I'd also like to mention that an upcoming webinar, our next ERC webinar, will be presented on August 19th at noon Pacific time again. Title of the webinar is Work Vehicle Safety, Eliminating Hazardous Activities While Safely Improving Productivity. This will be presented by Dr. Andrew S. Merriweather in partnership with Rocky Mountain COEH, University of Utah. For today's webinar, you will be muted during the presentation. If you'd like to ask a question, and we encourage you to do so, please enter it into the online Q&A rather than the chat window, if you don't mind. We'll save time at the end of the presentation to address these questions. And today's webinar will be recorded and made available with past webinars on the COEH Northern California YouTube channel. So please like and subscribe to help us grow our audience. Today's webinar, titled Fatigue, Sleep, and the Consequences of Adverse Work Schedules, is presented in partnership with the Southern California NIOSH Education and Research Center, University of California, Los Angeles, and COEH. In this webinar, we'll explore the factors that constitute an adverse work schedule, what jobs and industries are affected most, the best research on this topic, and how to protect the impact of any given work schedule, and what can be done to mitigate the impact of adverse work schedules. Our speaker today is George Brogmus. George is the Technical Director of Science and Technology with Liberty Mutual's Risk Control Services, responsible for establishing and coordinating research and development partnerships with universities and technology innovators. He is responsible for Liberty's Workplace Safety Index annual publication. He conducts safety research, writes peer-reviewed articles, and develops consulting tools and resources in the areas of back pain reduction, the aging workforce, upper extremity musculoskeletal disorders, same-level falls, and work scheduling and injury risk. George leads the development of the Liberty Mutual Ergo app and is co-developer of Liberty Mutual's biomechanical analysis software, Vidlatech. He is a creator of Liberty Mutual's SIRE, Work Scheduling Impact Risk Estimator, and BIRP, Back Injury Rate Prediction, and co-inventor of Liberty Mutual's patented musculoskeletal stress measurement system. He has a bachelor's in electrical engineering from UCLA and a master's in human factors from USC, and he's currently a PhD candidate in public health at UCLA. He's a certified professional ergonomist and a registered member of the Chartered Institute of Ergonomics and Human Factors. And George teaches graduate ergonomics and occupational safety courses at both UCLA and Cal State University Northridge, and has taught UCLA's monthly ergonomics webinars since 2008 through UCLA's NIOSH-funded Education and Research Center. With that, it's my pleasure to hand the mic over to George. Welcome, George.
Thank you, Alan. I probably should have written a shorter bio so I had a little more time to talk, but thank you for that.
It was great. There's a lot there. So it was excellent.
I appreciate that. You know, work schedules and sleep and fatigue, it's one of those things that kind of can go under the radar with a lot of organizations and a lot of even researchers. You know, the Workplace Safety Index that I lead, we're able to very consistently identify the events that cause workplace injuries. The number one, of course, being manual material handling activities, overexertion, is the BLS category that they put that in. But what kind of goes under the radar is, you know, the impact of the work schedules and sleep. This has been a hobby of mine for many years. I've written a couple papers or co-authored one and written one on this topic in the past, and it's always been of interest to me. But let me start with a couple of kind of provocative statements. Let's see if there we go. So I say here, we think we can get by with less and poorer quality sleep than we really need. And unfortunately, just because we are smart, or we think we're smart, or we're very educated, or we have an MD or a PhD, it doesn't necessarily help. I will confess my own shortcomings here. I know quite a bit about this topic, but I don't always practice what I preach. I don't always pursue what I preach. And so there's a part of this that we won't address, which is how do you get people to take action? Sometimes some researchers, some thinkers would say it takes a traumatic event before we change our behaviors. But one of the nice things about work scheduling is that employers and those that are in charge of the work itself can do a great number of things that can reduce the risk of injury and reduce the other adverse consequences that come with adverse work schedules. So that's kind of the good news of that. Today, in the time that we have, I want to talk really a fair amount on the broad scope of the consequences of tough work schedules. We'll also look at what you know, a real solid body of research has shown what factors of work schedules impact not just injury risk, but all the other consequent risks associated with adverse work schedules. And we'll talk about the importance of rest and sleep on productivity, quality, and safety. And in the middle of it, we'll give you a few tools that are available publicly for not only thinking and learning more about this topic, but also actually analyzing work schedules to predict risk. So this is early last year. This came out from the National Safety Council. They have done a lot of work over the past few years about fatigue in the workplace. And so they put out a very strong warning that we need to address fatigue in the workplace. 43% of employees in the study admitted they might be too tired to function safely on the job. That's a pretty big proportion of workers. 13% blamed injuries on sleep issues. And we know from vehicle research about 20 to 30% of vehicle crashes have either a primary or secondary cause related to fatigue. And there's estimates that fatigue costs the US economy more than 400 billion annually. And this is their little calculator. A company with 1,000 employees can count on losing over $1 million per year in missed work days, lower productivity, increased healthcare costs. So there's a very strong awareness within some groups that we need to address this topic. Now I'm going to open my chat window so I can see what you're chatting, and if anyone can identify what these dates have in common. What are all these dates? What do they have in common? Won't give you a huge amount of time. No, nobody? Either that or, okay. Kind of, Esmeralda. They're a little, exactly, Denise. These are all major disasters that have occurred. And One thing that's overrepresented in major disasters, if you look at these actual events, the last one being probably the most familiar to most of us is the Titanic, but all of these had elements of either fatigue or nighttime onset, or what we would consider the sleeping hours onset. So these are some pretty dramatic overrepresentation of fatigue and the time of day being overrepresented in some major disasters that we've seen over the last 100 years or so. Another overrepresentation happens to be weekend days. There's, I think, 8 or 9 events I have here, but we have about half of them represented on weekend days. And that's actually a paper that I wrote in 2007 on the risk of injury to workers by day of the week. So we also know that there's a high impact on fatigue driving. Now, I won't ask you to put in the chat window, but many of us can admit to dozing off, falling asleep at the wheel. 41% of all drivers admit to having fallen asleep while driving within the last year, 4% within the last month. I'm sorry, 11% within the last year, and 4% within the last month. So that's a pretty high percentage of folks out there that are fatigued. The 100-car naturalistic driving study, which is a just an awesome collection of data on real-time events, near crashes and crashes, showed that driving drowsy increased the risk of crashes 4 to 6 times, comparable to being intoxicated. And driving while drowsy contributing factor, they found a 22 to 24% of the crashes. European data, which is a little better on crash information than we are, shows up to 30% contribution. We also know that the impact on productivity is pretty severe. This is actually unpublished data. I've had it in my hands for decades now, but it's for electrical contractors, and it was data collected on their productivity over successive weeks of overtime and the various schedules you see on the right-hand side there. Everything from 6 days a week, 9 hours per day, and the parentheses actually shows you what net productivity was achieved from these workers at the end of those 4 weeks. So after 4 weeks, the productivity rates drop dramatically, especially for the more adverse schedules, like the very bottom one there, the 7 days per week, 12 hours per day for 4 weeks in a row. Essentially, by the end of that period of time, you're getting 40 hours of effective work out of the workers. So we know that there's a significant impact of productivity on fatigue, to the point where the cost of this is really ridiculous. 1 hour of work is costing you $2.65 in premium. So it's not really worth it to work workers this way. If you extend that out to the most extreme, 7 days a week, 16 hours per day. I did a little regression equation on this to find the factors here. And you end up getting less than half a week of productive work out of workers after 4 weeks. And we do actually see this in some industries, in the seafood industry, where you go, when the fish come in, you got to work nonstop, and they actually perceive a 16-hour day as a short day. Because they will often work 18-hour days there. So we've seen research that validates this in the construction industry in another broader based research project, 88 construction projects. What they found was that approximately 4 to 5%, they found a 4 to 5% drop in productivity for every 5 hours per week per worker over 40 hours. Now, they had kind of an odd way of measuring productivity in that, but I think the principle is pretty sound, is that if you work people too hard and they can't get the rest they need, they will drop their productivity. We know also that people, not only do they need rest between each day, so that they need the time to get sleep and get their life tasks completed, we also know that you got to give people the rest they need within the day. And this is old research. This is from 1954, which showed if you only give them a lunch break compared to giving workers periodic hourly breaks, what happens is workers will take the breaks they need really beyond what they need in what is called either spontaneous breaks. A spontaneous break is when the worker's working and then they completely stop doing something. They just stand there, or they just walk away from work. A disguised break, it looks like they're doing something, but they're not doing their actual work task. So they're getting away from the both the monotony and the repetitiveness perhaps of that task. But if you give them the breaks they need, indicated in the second bar there with the black portion being the prescribed breaks, they actually take fewer spontaneous breaks and fewer disguised breaks, so that the total time working is increased and the net productivity, the net output per day is increased. The time to produce each part is reduced, so you have greater productivity by the end of the day. So this is an important principle, and as ergonomists, which I am, you know, this is the kind of stuff we love. You know, you give people the physiological benefits they need to get the work done more efficiently, and you get more out of the system, and you have the system participants, namely people, who are less stressed and more productive. So there's a win-win. My favorite study on this rest break issue, giving people the physiological rest they need during the day, is this one by Dababneh, I'm sorry. Always pronounce that wrong the first time through. So this study was done on hygiene packers, which you can imagine is a very repetitive job. They looked at them with existing 30 minutes lunch and our two traditional 15-minute morning or early shift and late of the shift breaks. They tested two different breaks, adding 36 minutes of total break time for the day. The results at the end of the day, no change in total daily output, because they increased their productivity mostly at the later half of the shift by about the same percentage that was taken up with rest break time. And yet at the same time that they had this increased productivity rate and were able to maintain their total daily output, they had a 30% decrease in discomfort ratings. And you can probably guess that workers preferred the 9-minute break, because in 3 minutes, it's really hard to, you know, even go run and get a snack. So the other impact that adverse work schedules have, or really I should say not getting enough sleep has, there's a very strong effect of memory and learning on our sleep. Now, interestingly, the effect that's being demonstrated here is getting sleep immediately after you've learned. So if any of you are students, if you're going to cram, get sleep right after cramming. Don't cram all night and don't get any sleep, because you need that sleep to kind of organize your brain. Takes the job of organizing the information you've learned and retaining it. And so what this study showed was that if you could sleep immediately after learning, in this case it was pairs of words, you're going to do a lot better than people that stay awake for a long time after learning. So some interesting implications there. Two resources that I would say, or I should say one resource, two videos that I highly recommend going and seeing. I usually show them during these kinds of training sessions, but for time's sake and for technology's sake, I'm just referring you to them. But Harvard has a healthy sleep site that has some fantastic tools and some great videos from some of the top experts in the world. The one that I really enjoy, that I find the most fascinating really, is the second video by Dr. Stiggold, who talks about how the first thing to go when we don't get enough sleep is our judgment. It's kind of like the drunk driver that thinks they're fine, because the first thing that they lose is their judgment as well. This was reinforced recently with a study on emergency room physicians, 5-month observation period of various metrics, including psychomotor performance tasks and all kinds of things that are, sorry about that. I'll mute that, it doesn't happen again. But what they found was that people underestimate how fatigued they are and the impairments that are related to that, and giving the workers the illusion of being in control and hinder the deployment of mitigation strategies. And this is probably one of the problems when you get fatigued, is you just don't realize you are fatigued. Which also calls for implementing external measures of monitoring fatigue. So we've seen disasters, crashes, productivity, learning memory. There's also medical error research. Medical errors increased with shift length, that's been shown. Risk of cardiac arrest, death due to patients, not due to patients, but to patients themselves. So your risk of having a cardiac arrest and dying are greater if you're in a hospital at night or on the weekends. So that's pretty scary for patients. So not only do medical practitioners make errors, but they also have higher risk of injuries, higher risk of crashes. And the big one to me is medical errors. If one statistic that I like to quote is that in an interview of, I believe it was about 2,000 medical interns, 1 out of 5 of them admitted to a fatigue-related error that harmed a patient. And if you can believe it, 1 out of 20 actually admitted to causing the death of a patient because of fatigue. So the very first, in the role that I'm in now to seek out research from universities and technology developers, the very first research project I commissioned was with a Harvard researcher to do a meta-analysis of the research on medical errors and fatigue. And I'd hoped to actually have that done by today, but with COVID, it's set back that review. Probably won't see that for another couple months, but we're very eager to see those results and find the risk factors to physicians for both medical errors and injuries to themselves. There's also all these health effects: obesity, cardiovascular disease. The World Health Organization in 2007 declared shift work to be probably carcinogenic. Gastrointestinal disorders are frequently reported, possible reproductive effects, and we know that immunity is compromised. Those 2 studies I quoted are actually related to, one of them is a study, the following one is a comment on that, but related to potentially increased risk for COVID-19 infection. So there's a lot of issues here, obviously. What about workplace injuries? That's what I tend to focus on, and that's where there's a great body of research that allows us to actually predict the risk of injuries based on the work schedule alone. So what aspect? Well, there's been some really great research, as they say, and although this chart, you can very clearly see that if you look at the standard 40-hour week in the referent bar there, and you compare it to more than that, you see that there is an increased risk for 41 to 50 hours, all the way up to 60 hours, about the same. For some reason, it drops off at 60 hours and is increased between 21 and 30 hours. Now, I could talk about some of the reasons why, but what I want to point out is that it's not all about just the number of hours worked per week. There's other factors here. Some of them have to do with part-time, some of them have to do with multiple jobs, but there's the real telling data is not this graph. The telling data is based on sleep. Now, let me take a pause here and say that when you sleep, I'm sorry, when your ability to get sleep is very heavily correlated to your work schedule. If you're working a 20-hour day, you cannot get 8 hours sleep, period. There's no way. It's physically impossible. You can only get 4 at the absolute most. And even then, if you factor in commuting time and whatnot, it's even less. So our schedules, to a large degree, determine our opportunity for sleep. It doesn't necessarily mean we get good quality sleep. It doesn't necessarily mean that we'll take the opportunity to get that sleep. But the work schedule is a very close proxy for our ability to sleep. But if we look at the factor of sleep itself, we see that there's this extremely strong relationship between the hours of sleep we get and the rate of injuries that we see. So this is direct rate of injuries with based on relative risk. So if you take the 7 to 7.9 hours, that's our referent sleep range here, and you see that if you get less than that, the risk of injury increases dramatically. If you get more than that, it tends to stay about flat until you get to greater than 10 hours. And The greater than 10 hours not only is a much smaller sample size in this study, but it's also probably something is also potentially medically going on when you're getting 10 hours more sleep. Could be depression, could be medication use. So the increase in rate of injuries there is probably correlated to some other factor. All right, so the best study done to date is the systematic review by Fisher et al. Believe Fisher was I believe a Harvard intern at Liberty Mutual Research Institute when this paper was written, along with Dr. Lombardi, the epidemiologist. And they looked at quite a few articles. And basically, this is a update of a previous study by Dr. Lombardi and Dr. Folcard that was published in 2006. And the findings they had here were the same ones they had previous, just quantified a little more specifically with more research studies to back it up. But basically, here's the findings. Time of shift is important. If night shifts, you have a 36% increased rate of injuries compared to morning shifts, and afternoon shifts, 12% increased rate of injury compared to what we consider a normal day shift or morning shift. Number of consecutive shifts in a row also increased. Morning shifts increased by 9% as you increased up to the fourth consecutive shift in a row. Night shifts increased 36%. So you had a much more dramatic increase in night. And we'll see this in some graphs to reinforce it real quick here. Increase past the 9th hour for the shift length. And the impact of rest breaks was also quantified here. For any duration of rest break, had significantly decreased risk. I mean, if you don't have a rest break, you're probably, some of these data would be based on non-US data where the worker did not get a rest break. So you have basically a 65% decrease in rate of injury if you give somebody any length of rest break between 21 and 30 minutes per day. That's cumulative rest break. And the risk is increased with a greater time between breaks. So the longer you have a span of work without giving a break, the higher the risk of injury, pretty dramatically higher. So seeing that in just graph form, basically the hours on duty here shows you that as you work through your work day, your risk of injury is relatively low during the first 8 hours and then increases dramatically going up from there. Length of the shift also matters, and the number of shifts in a row, as I've said. So increasing risk, the more dramatic on the night shifts. So consecutive night shifts in a row increase the risk of injury much more than day shift. And finally, the frequency of rest breaks. Now, these two graphs require a little bit of explanation. The top graph there shows the total duration of rest breaks through the day, and you see the referent rest break time is 0 minutes. But if you give people even 30 minutes, the risk drops about in half, and then even further for 31 to 60 minutes, and greater than 60 minutes, it stays about the same. The bottom graph comes from two studies based on automobile manufacturing tasks. And these tasks were the same exact tasks through 3 different shifts. So they were able to verify this trend as not day related, but independently the rest break related. And essentially what this shows is that if you look at when people report injuries between within a 2-hour break, they report more injuries after 30 minutes, even more after 60 minutes, and even more during the last 30-minute period of that 2 hours. So that the implication is if people had more frequent breaks, then you'd interrupt this fatigue-related injury cycle. Now, if you put all those factors together, the tough part is you can't just judge it based on hours per day, hours per week worked. If you look at the parenthetical hours per schedule numbers in the bottom, you can have a 60-hour per week schedule that has much less risk than a 48-hour night schedule compared to a 60-hour day schedule with frequent breaks. So a couple of groups have put together calculators and modeled these various factors using research that's published. As Alan mentioned, I created a tool for my company that puts these factors together kind of in a straightforward fashion. The UK has created what they call their risk and fatigue indices. And I've given you the website where you can go and you can download that. And I've heard there's might be some issues with more recent versions of Excel, but you basically enter in a work schedule and it'll tell you an index for the risk of injury, and you can compare one schedule to another to make decisions on work scheduling. Fatigue science, the organization Fatigue Science, drawing upon some research that is classified research from the military. They've created a tool called Ready, and Ready is also a tool for risk scheduling. That's a for purchase type of tool. And Circadian Technologies is probably the leader. They are fed by a lot of Harvard folks that provide consulting training, and they have several software programs. So the point to this and the news, the good news on this is that there are tools that you can use to analyze the work schedule for risk and fatigue. A little bit about how our system works when it comes to sleep and fatigue. Here's a really fun word to use, but the part of your brain that controls, the part of your brain that's your timekeeper is your suprachiasmatic nucleus, if I could even say it. And that's, you might think that you might find that in a Disney musical someday, but suprachiasmatic nucleus is a fun word. And there's an interplay between external cues, referred to as zeitgebers, time givers, and our internal clock, our suprachiasmatic nucleus. And our sleep drive increases as soon as you wake up. You begin to get a increasing sleep drive, but it's compensated by an alerting signal that our brain gives out, and so we're able to maintain relatively constant alertness throughout the day. We do have a brain-related dip. I think it's around 3 or 4 p.m. I'll show you on the next slide. But it allows us, the alertness there is the white center line, and there is that dip like in the afternoon. That's not because of food, that's because of the way our cycle and brain is working. And you have this orange alerting signal. And so our sleep drive increases, but the alerting signal compensates for that so that our alertness remains fairly stable up until around 11, up until, let's see, yeah, that should be 11 p.m. Yeah, that's right, around 11 p.m. I've superimposed our endogenous melatonin production. So your brain also produces melatonin, and this melatonin helps you get to sleep. And it increases up to about 2 a.m. And so it gives you a pretty solid sleep, and then decreases, and then you wake up in the morning. So that's kind of the flow of how this our brains work. The main cue for all this, of course, is daylight. Daylight at midday. So it naturally occurs at midday in the 48 lower U.S. states. In Alaska, it can be a problem. Night shift workers need that boost of daylight to tell their suprachiasmatic nucleus that that they want it to be as if it's day around midnight. Risk of sleep disruption if bright light exposure is within about 4 hours before sleep. So if you get that bright dose during the day, it messes up your internal clock if you're a night worker. It must be long enough and strong enough to allow you to sleep. So if you feel particularly poor sleep on very cloudy days, it could be because your suprachiasmatic nucleus didn't get the signal that it was daytime. Melatonin, strong antioxidant, is believed to play a role in immunity, aging, and even cancer suppression. Increased levels make you sleepy. Produced in the pineal gland, it can act on receptors in the suprachiasmatic nucleus to phase advance the biological clock. It's been shown to be effective for jet lag and possibly suppressed by strong light toward the blue end of the spectrum, which is where this whole blue light issue has come in. And it used to be that glasses with the right blue light filtering cost like $400. Now you can get them for like, I think, 20 or 30 bucks online. So that's a possible improvement to sleep. Not recommended unless 3 days or more in the new time zone or new work schedule. Timing is very important. Short-term use appears safe, although I wouldn't personally give an endorsement for it. It's recommended that you use synthesized melatonin because of the obscure but actual risk of prion diseases. Concerns with epilepsy and warfarin, not recommended for children or pregnant nursing women. Personally, I think messing with your internal hormones is probably not the wisest thing to do, but it is a popular topic out there, so I included it. In terms of the light issues, there are some studies that show benefits of filtering out a certain wavelength of blue light on the blue end of the spectrum. But in this review of 68 studies on the topic, the only real solid finding was that increased intensity of polychromatic, basically white light, increased alertness. And of course, that was something we already knew would happen if you timed it at proper time during the day. So unfortunately, few studies have looked at really important outcomes like reaction time, and those that did reported few significant effects. So what influences our sleep? The most important thing, as I said, is availability, our work schedule. So if we are working one of these adverse work schedules and we don't get the sleep we need, we will compromise our sleep. Likewise, if you don't have a work schedule that allows you the physiological rest within the day, which is things like rest breaks, we also compromise our fatigue, if you will. Timing of bright light, timing of caffeine, and I'll talk about some of these in a little more detail here. Caffeine, food, and exercise. So first I'm going to start with a story. So my wife and I, gosh, it was probably about five or so years ago, after about 15 years of marriage, we realized that our body shapes were changing in a way that we didn't appreciate. So we had gone from being two people who exercise quite frequently to two people that enjoyed just sitting and looking into each other's eyes most of the time. So, and that did happen gradually over time, but we realized we need to kick into gear and get some exercise. So we purchased one of these programs where you do calisthenics with a very aggressive coach. I won't say what name it was. We loved it. It was awesome. But with two little kids in the house, we would get to start this around, we were fortunate, around 10 p.m., usually around 11 p.m. It would take us about an hour and a half. And by the time we were done, it was anywhere past midnight by a half an hour to an hour and a half. And then guess what? We could not sleep worth a darn. We were getting 2 or 3 hours sleep because we were up the next 3 or 4 hours because we were so activated because of the exercise. So we unfortunately had to stop that and have gone to more moderate walks and things that to try to regulate some of our health metrics. But that's that's one of the issues with getting exercise at the wrong time of day. It can activate you so you get a poor quality or quantity of sleep. The other story I have comes from a fellow consultant who was actually somebody who was, they're no longer with us, so I can say this. They were supposed to know a lot about wellness, and they and I would sometimes compete for how little sleep. We would brag about this, and I'm not proud of that now, but we would brag about it. And they said, yeah, that's why I need my 2 glasses of wine before I go to bed. And I'm like, well, wait a minute, that might get you to sleep, but that's gonna, metabolize, and you'll be getting a high in the middle. You'll be getting a sugar high in the middle of, after a couple hours of that metabolizing, you won't be able to sleep. And I don't think they really liked that advice, but we have to watch out for that. One of the easiest things, and one of the relationships that sleep can have on obesity, is that if you stay up late enough and you don't get enough sleep, there's a cascade of issues that happen, including becoming hungry as you stay up late, which means that you go and eat, and your sense of appetite gets thrown off. So you tend to eat more than you really need to or want to in the first place. So these are some kind of the interacting elements that not necessarily covered here. Caffeine, definitely an effective stimulant, can help during the day for to keep workers alert, and many self-medicate with caffeine for that reason in the morning and in the afternoon. The problem is if you are a consumer of caffeine within 6 hours of sleep, it may disrupt or delay your sleep. Food, obviously we have to have it. Increased acid up to 2 to 3 hours after eating. Some of you in my age range know that this is a pretty sure recipe for heartburn and having to get up in the middle of the night and sleeping up or take some kind of anti-acid pill or tablet. And as I said, alcohol can help you get to sleep, but acts as a stimulant 2 or 3 hours later. So we have to be careful. Now, you and I may know about this. Many workers don't really realize these things. So how are you going to get that information to them is the question. Exercise, obviously good for you, but as I've related, if you get it too close to trying to go to sleep, it's going to disrupt the sleep. Best is during your circadian afternoon. And there is some proven benefits to getting 3 minutes of exercise during work, aerobic, not stretching. I would probably love to, although the studies themselves have been on aerobic exercises to increase alertness during adverse work schedules. I prefer to describe those as warm-up exercises. Aerobic may increase the risk for some workers, and warm-up is generally at a level where you're just trying to activate increased blood flow, so not necessarily to a higher aerobic level. Do workers have a good quality mattress? So there's things that the individual worker can do. A mattress is probably the hardest thing to select. We have a lot more choices today. We have a lot of marketing with those choices. So finding out one that really gives you good quality sleep can be a little bit of a trick and a long-term endeavor. Is the sleeping area dark? Dark, as we said, light activates our internal clock. So if this is pretty common sense, but you got to have the area dark if somebody's trying to sleep during the day. Is it quiet? Or can it be interrupted by people, children, cell phones? Are they in a facility where they're sleeping with others, PA system? All those things are potential disruptors to sleep. Of course, there are some tricks, white noise, fan noise to drown out background noises. Sleeping mask over the eyes is another thing people sometimes are comfortable doing. There are ways to measure sleep. 5 or 10 years ago, the thought of having a wearable to monitor your sleep was kind of a hard thing to do. Now it's extremely common, many wearables. There are some commercial systems available for deploying certain wearable type of sensors to workers to detect fatigue and detect alertness. But that's a whole nother webinar of the availability of those kind of things, but that is something to consider. And then there are more simple smartphone device apps to monitor your sleep, to time your sleep better, to time your waking better, because your best time to wake is dependent on the phase of sleep that you're in. Basically, you want to get into the deepest level of sleep before you become awake. You don't want to interrupt that full cycle. It's better to get full cycles of sleep. And there are just manual scales. This Epworth sleepiness scale that I'm showing here gives you a simple scoring method for common activities to find out if you do have some sleep issues. And of course, males, especially over 50 that are overweight or obese, have a high risk of sleep apnea. For those of you that don't know, sleep apnea is a condition where you can be waking up to 300 times during the night and not know it. You never get into your deep sleep cycles, and it can be very disadvantageous to general health. So it's something that does need to be, you need to be aware of. And there are, there are monitoring devices that sleep physicians, and many times your personal physician will have, that can monitor your sleep for sleep apnea. One kind of close to closing comments here is, with all this knowledge that we have on the impact of work schedules, adverse work schedules on all kinds of things, everything from disasters to injuries to personal health to medical errors. Unfortunately, there are no federal regulations for general work hour limits. Instead, there's pay-related issues. So over 40 hours per week at a time, you have to earn time and a half pay. Federal law does not even require lunch or coffee breaks. Brief breaks are compensable when provided, but that's about the extent of it. The DOT, of course, has regulations that limit drivers to 60 hours for every 7 days. It shouldn't be 60 plus, it should just be 60 there, by the way. 70 hours for 8 days, but they're allowed at one, at one run to do 14 hours straight. They are required to have 11 hours off after that, and 8 hours of it have to be sleep. But most of this, I believe, is all self-reported. So I'm sure there's plenty of ways around this regulation. FAA, depending on the kind of flight, is anywhere from 9 to 14 hours. And that is recorded from when they're supposed to report to work to when the last flight has parked at the airport. The Accredited Council of Graduate Medical Education, I think I got that right, the ACGME guidelines call for 80 hours per week. But these folks who, medical should know better than anybody the adverse effects of adverse work schedules. They let their physicians work up to 30 hours straight. Now, where that logic comes in and where that expensive education comes in, I don't know. But as a profession, as an individual, I understand the difficulty in controlling individual behavior. It's a big challenge. But for a profession, I kind of think that needs to take a shift. Europe has much more clear guidelines, although there are opting out. Workers can opt out of these, the working time, the European Union Working Time Directive, but there, this is more research-based. Maybe not with France, with 35 hours per week maximum, 7 days, but the rest of it is pretty research-based in terms of the advantages of doing these things. You'll also notice that it calls for, the very bottom there, calls for free health assessment for night workers, which is, I think, another good thing to detect things like sleep apnea and other issues that may prevent someone from getting sleep. I'm sharing one success story. There are a number of published stories out there. A few of them I've cited at the very bottom here for you to follow up on. But this study I like because they had a very creative way of integrating additional rest breaks. Their alternative was to build an additional assembly line, but they realized that they could increase productivity by scheduling everyone's work break so that 2 workers were off on their scheduled break periodically, so that at any one time there were still 12 workers working, but they had 2 workers that were taking their break time. They recognized that productivity rate increased, but discomfort ratings dropped by about 75% with these added breaks, and 90% of the workers liked this new schedule. So, so this is one example of a success. Other examples have come from a Dutch steel company, a Belgian railway traffic control situation, and the Weaver study is basically related to physicians, showing that shorter shifts resulted in fewer crashes, fewer injuries, and fewer medical errors. So it does work. What you can do, what can be done, I'm getting a little close on my time here, so I'll accelerate a little bit here. But obviously changing the work schedule makes the biggest impact, often the hardest thing to do. Increasing the frequency of breaks. What I always recommend is, hey, try it. Try it on a trial basis. If you don't see the benefits to it that outweigh the cost of that time not working, then you can always go back to the old schedule. Ensure good quality sleep. Ensure good sleep preparation with light, control of light, and exercise, perhaps a warm-up exercise during midday. Periodic medical evaluations. And there's things that we can train workers on. One of which, by the way, all of which I've mentioned except for the last one, is cautioning workers on multiple jobs. This is very common for nurses and others in the healthcare field, but other jobs that are part-time may have higher risk because they're working multiple jobs, not because they're working less. Summary: adverse work schedules equals adverse consequences, including productivity. Workplace improvements are practical and effective without compromising productivity or quality. And there are, not only are there things the workplace can do, but there are personal interventions that informed workers can make to mitigate those effects of risky work schedules. A few key resources that will be included in the PDF that you get. NIOSH's plain language about shift work is old, but it is really still filled with a lot of good practical information. Thank you, Alan. I'll turn it back over to you. If there's any questions, I'll be happy to try to respond to them.
That's great. Thank you, George, for an excellent presentation. Please feel free to drop any questions you might have for George into the into the Q&A box, and we'll get to those. I have a question for you.
Okay.
A couple, actually. Also, guess I'll kick it off. You said, one of the slides said that shift work is carcinogenic. Can you explain that for me?
Well, I can't give you too much explanation, but it was declared by the World Health Organization in 2007 to be probably carcinogenic based on the research they had available at the time. I haven't done any follow-up on that, but it has to do with disrupting melatonin levels and the role that the melatonin has in cancer cell growth repression is what I understand.
I see.
Whether that's actually the mechanism or not, or whether it's more complicated than that, I really don't know. But there's enough correlation to give that warning by the World Health Organization.
Okay, thank you. Given the impacts of COVID on supply chains and production, I imagine this has really been disruptive in terms of the shift work paradigm. And I'm wondering, is there anything beyond increased breaks and duration of breaks that can benefit shift workers?
Yeah, I mean, obviously those are going to make the biggest impact, not having them work as long. If one of the traditions that we have in the US is to put people on permanent work schedules. And so if you work a night shift, you work a night shift. Europe does not have that same tradition. They use rotating shifts, and forward rotating shifts are known to be better than backward, by the way. That's just a tidbit. So there's that option. It's a little harder to introduce in our culture because there's high resistance to even working one shift a week on the night shift. But that is a more sound way of doing it. You still have to have certain precautions, and you still have to realize that there's adjustment time needed when you go from one schedule to another. But that's kind of the norm for shift work in Europe, where it's not the norm here, and it could be an opportunity. Again, keep in mind the main thing is, can you achieve sufficient quantity and quality of sleep? If you can achieve that, then you've got the puzzle solved. There's no more needed. I'll give you one real simple practical example. Work with a company in Alaska, and they had a lunchroom, so people would come in mid-break for lunch. Well, why not increase the lighting level in there so it's sufficient for the half an hour or 45 minutes they're in there to give them their light dose? And why not provide them with, dark glasses if they're going out into the bright sunshine, which in the place I was working, there was rarely any bright sunshine. But you didn't have to worry about that. But that simple, workplace change could affect the alertness and the circadian rhythms of the people working there.
Okay, thank you. I noticed on one of the slides that the adjusted odds ratio went down for working over 60 hours per week, and it looked like a significant drop. Can you speak to that briefly?
That's a good question, and the authors may give some explanation with that. I don't recall, other than knowing that those tend to have a smaller sample size, so a little higher variability in what they're reporting. It could also be the nature of the kind of jobs that those represent, and that there's a lower risk overall compared to other jobs.
Okay, thank you.
Those would be my guesses, but again, it'd be good to read the article to see what they suggest.
Great. Okay, thank you. I have a couple of questions now coming in from attendees.
Sure.
Are naps recommended for workers on a lunch break?
So naps, it depends on who you ask, what expert you ask for their opinion. The one thing I think is true is that if you do allow for naps, that they don't exceed 15 minutes, because generally after 15 minutes, you get into what's called sleep inertia, which is what many of us experience when we get up in the morning, which we need, 15 to 20 minutes or more before we're really alert. And so if you give the person a full, half an hour nap or 45-minute nap in the middle of their shift, they're likely to take another 15, 20 to half an hour before they're alert. And if they're not alert, if they have a job that has risk because of not being alert, that can be very bad. So that's the only thing I would say. But in general, most, if you don't have any other as a last resort kind of thing, a nap could be something to experiment with.
Great. I'm a fan of naps. Do you, here's an interesting question for you. Do you have any recommendations on wearables for screening sleep apnea on apps?
I don't, but I would defer to your physician or to a sleep physician, somebody specializing in sleep disorders, and they probably have a decent recommendation. If it was me choosing, I'd look for the number of ratings and how high they rated it, but that's really not helping you much. I would defer to a physician on recommendations there. Otherwise, there's probably little to no harm in trying one out and seeing if you experience a better night's sleep. So most of them are low cost or no cost, so you could try one out and see if that helps. The biggest thing to do, of course, is detect things like sleep apnea. If you have that, you need medical attention. You need to see a physician right away on that.
Sure. And in any of your work, have you looked at prion diseases?
I have not personally, and that the warning on using synthesized melatonin versus natural is simply from readings on those that have published on that topic, but I don't know how likely or risky that is. In most things, I would think that naturally produced materials or medications would be better for you, but in this case, they recommend the synthesized version.
Great. Okay, another question. Do eye comfort phones work, and do they cause harm to your eyes when operating a cell phone in the dark? I'm not familiar with that.
So I'm not familiar with that either, and I can only kind of project that probably means that they have either a reduced light emission or a reduced spectrum on the phone being produced. I don't know. I'm sorry.
Is it correct that it's the blue wavelengths that are disruptive for sleep?
That's what's been proposed, but honestly, the earliest research on that was very closely conflict of interest research, in my opinion. The researchers looking at that were funded by the people producing the $400 glasses to filter out those light waves.
Yeah, that's
So
Definitely sounds like a conflict there.
yeah, buyer beware, user beware. I actually, and this isn't a testimony to it, but my son for Father's Day bought me a pair of reading glasses that have the filtering. Again, I think they were under $30, so it wasn't the high-end kind here, but I mean, I can't anecdotally report anything other than to say I haven't experienced any harm or any additional symptoms from it.
Got you. Well, several more questions came in, but we have run out of time. What I'm going to do is forward these questions off to George for him to look at, and perhaps he can attempt to answer those offline. So with that, I'd like to thank you very much, George, for that presentation.
Oh, my pleasure.
And
For the
thank you
opportunity.
everyone for joining us today. You can learn more and register for our upcoming webinars at coeh.berkeley.edu. You can also subscribe to our YouTube channel, where you can find recordings of previous webinars and other events. And as a reminder, all who participated logged in with their registration today, with their registration email, will receive a link to the evaluation form, which will qualify participants for a certificate of completion worth 1 continuing education contact hour. And with that, I'll say thank you very much, and be good to each other, stay safe, and we'll see you next time.
Thank you, Alan.
Bye-bye.